Hello, my name is Harry Morrall. This is PHP assignment 1. I'll be doing my multimedia presentation on the Bendigo Community Health Services Centre. Here is just a brief introduction. I'm doing my presentation on the Bendigo Community Health Services Centre. It's located in central Bendigo, Eagle Hawk, Elmore and Kangaroo Flat. We'll be going over the services provided, also more specific details on the locations, the affordability, the accessibility and the limitations of it. So Bendigo Community Health Services Centre has a massive range of services, starting off with just a general practitioner. Now, there are female and male GPs available to cater towards people with different religious beliefs and sexes and backgrounds and that kind of stuff. So if someone is uncomfortable with a female or a male doctor, they have a choice. There is high level drug and alcohol counselling. Now, everything is completely confidential at the Bendigo Community Health Services Centre. So if someone is affected by drugs and alcohol, they're able to go and talk to counsellors in private. And also, if someone is feeling a tendency to start using drugs and alcohol as a means of an outlet, they're able to go there as well. This is available to anyone of any age, and as I said, it's completely confidential. They offer a men's health clinic and a women's health clinic. They are located in Eagle Hawk and the Bendigo campuses, which we'll talk about as well, as to why that's good and why that's also a little bit inconvenient. The men's and women's health clinics look at blood pressure, cholesterol levels, and all that kind of stuff specified to what sex you are, and then it helps you just improve general healthy living and lifestyles and stuff. Something I'm quite passionate about that they do is the youth services. Now, the youth services provide sexual health information and advice. They also have a lot of pregnancy support and advice, which I think is quite important for the young population of Bendigo, especially considering the fact that people are starting to get sexually active at a younger age, and that pregnancy is quite a big issue if they're not getting support from home. There is also contraception and advice. They also give out a lot of advice on sexually transmitted infections and blood-borne virus testing. So if you believe you've contracted an STI, you're able to go here and they'll do a free test for you, and they'll be able to assess if they can help you or not. They also give out a lot of information on that kind of stuff. They give emergency contraception, so the morning after pill, and they give out free condoms as well to young people and people of any age, but specifically young people, to combat sexually transmitted infections. If you're a girl, you can go talk about irregular period cycles. There is counselling for young people. There's young, pregnant and parenting programs, which is essential at the moment, especially with people who come from a house environment where they're not getting supported. There is alcohol and other drug support, LGBTQI support for young people, general health, how to quit smoking, and just general information on issues such as diabetes and stuff in young people. We're living in a population these days where obesity has become quite a big issue. So the youth health clinic is located only at the Bendigo site as well, which can make it difficult, but we'll get to that in the limitations. So they also provide general services around staying healthy. So they can teach you how to make meal plans, how to eat healthier, and cutting out junk food, that kind of stuff. And just around a healthy lifestyle in terms of exercise and recommended exercise for young people and everyone else. They do refugee help as well. So refugees who've moved to the Bendigo area, they reach out and support. And then they also have specified LGBTQI counselling, which is a recent addition to the health services provided. They also have other services, but they're all kind of rolled in and connected together through the men's and women's health clinics and other things like that. Now, locations. It's located central Bendigo, Kangaroo Flat, Eagle Hawk, and then there's a rural one as well in Elmore, which is north of Bendigo. As you can see, the addresses are on the screen. So it is a not-for-profit organisation, and it is actually a registered charity too. So that means that any money received from donations is put straight back into the community as well. Uh, the GP services are bulk billed and are Medicare subsidised as well. So obviously there's an excess for medications and specialised services. So if you need to get a prescription for something, say Ventolin, you can go to and talk to a GP and they will prescribe it for you, and it just goes through Medicare. Anyone is able to donate to this service as well. Just as a little plug, they have on the website a description of how much money, and how much money can feed a family and that kind of stuff. Oh, that's the other thing, is it's also a soup kitchen as well. So if the homeless people and anyone who's hungry is able to go in there and have soup, or they do other kinds of meals and cater to halal and that kind of stuff, they will be able to feed you. Accessibility. So there are 4 convenient branches. They're located in the lower socioeconomic parts of the town as well, Eagle Hawk and Kangaroo Flat. Just as a broad term, there is a lot of commission housing around those 2 specific areas, and obviously the Bendigo location is convenient too, because elderly people and anyone who's attending school or TAFE or university is able to access that. So the Elmore location, I think, is a fantastic idea, because coming from a rural background, it is sometimes difficult to access basic healthcare needs and basic, just support in general if you say a drug or alcohol affected. So everyone in the surrounding area of Elmore, Rochester, that kind of area, is able to come to that health clinic and that branch. In terms of aesthetics and physical accessibility, all of the branches are wheelchair accessible, for whether you're disabled, whether you're on crutches, they can access it. There are stairs there as well, and parking is also available at all of the sites. Now, I went to the Bendigo branch and I found that the parking at the front you had to pay for it, but it was still easy to get in and out, and the people actually in the clinic are willing to come and help people out if they can't get out of their cars or whatever. Now, the services are roughly open between 9 and 5 days a week, so Monday to Friday. The Bendigo branch opens at 8:45 and closes at 5:15. The Kangaroo Flat branch, obviously on Wednesdays, closes at 7:30. The Rochester is strictly 9 to 5, but none of them open on weekends, which again we will discuss in the limitations, which is up next. I did find that they do provide, if needed, round the clock phone service for counselling, but that's more through Headspace, and they direct off to Headspace, which is good, and that's part of their website, is that you can see a list of services that you can access outside of the hours, and just other services in general that you can access via the phone. Limitations. All right, something that I found was the timing of it. So being a university student, or whether you work or whatever you do, you might not be able to get to the health clinic within the 9 to 5 ratio they run, because most people work 9 to 5, and I thought that maybe they might be open Saturdays or something, so like doctors' clinics, they can go in, people can go in and access healthcare and advice and things like that, but they aren't, which is a severe limitation for a lot of people. Obviously, if you're an elderly person or you're retired, you're able to access it throughout the week, but someone who's trying to support a family and needs advice can't get there. The rural campus as well, I thought was a fantastic idea, but I believe that there could be more. So that rural campus is only North Bendigo, so you've got to go out through Epsom and keep going. You look at all the rural parts of, say West Bendigo, Bridgewater, Inglewood, Wedderburn, that part of it, and then you could even go east out to Heathcote, and then obviously go south down towards Castlemaine and Melbourne, which is still towards parts of Bendigo. I think that making it more accessible to more rural people is a fantastic idea. Also, the fact that the men's and women's health clinics are only at 2 of the campuses, I think could be improved, because some people aren't willing to travel for that kind of advice, and I think that we could potentially have a healthier population if there was more campuses with the men's and women's health clinics. Thank you for listening to my presentations. The references will be on the guided questions sheet. Please ask me if you have any other questions. Thank you.